You know, those first 5 minutes of a person's life are some of the most intense and important they will ever experience. To an outsider, it might look like a blur of activity, maybe even a little chaotic, but it's actually an incredibly precise, well-rehearsed sequence of events. Today, we're going to pull back the curtain and break down exactly what happens in those crucial first moments.
And it all starts with that first cry. But that's not just a sound, it's basically the starting gun. The second it happens, it confirms the baby is breathing and it activates a medical team's well-practiced checklist, a list that's designed to make that huge transition from the womb to the world as safe as it can possibly be.
So, right away, the team jumps into action. And their first priorities? They're actually pretty simple, but absolutely vital. First, keep the baby warm, often with that amazing skin-to-skin contact, and dry them off really well. And if they need it, the team will gently clear the baby's airway, just to make sure that first breath and every single one that follows is strong and clear.
And you won't believe this, but almost right away, the baby gets their very first report card. Now, it's not about grades, but it is all about their health. It's called the APGAR score, and it's a super fast and effective way to get a snapshot of how the newborn is doing.
So what exactly is this APGAR score? Well, think of it as a super quick, standardized cheat sheet that gives the delivery team an immediate summary of the baby's condition. And the name itself? It's actually a brilliant little memory aid.
And here's the really cool part. The name itself, APGAR, is an acronym. It's a clever way to remember the 5 things they're checking. A is for appearance, meaning skin color. P is for pulse, or heart rate. G is for grimace, which is the reflex response. A is for activity, or muscle tone. And finally, R is for respiration, their breathing effort. See? Pretty smart.
Okay, so here's how it works. Each of those 5 things we just mentioned gets a score, 0, 1, or 2. Let's take appearance, for example. A baby who is nice and pink all over gets a solid 2. If their body is pink but their hands and feet are a little bluish, that's a 1. And if they're pale or blue all over, that's a 0. Then they just add up all the points.
Now, this isn't a one-and-done kind of test. Nope. They do it twice. The first test, at 1 minute, gives the team a quick read on how the baby handled the whole birthing process. But the 5-minute score, that one's even more important. It shows how well the baby is adjusting to this brand new world.
So, what's a good score? Anything from a 7 to a 10 is considered normal. And honestly, this is the range most babies fall into, which is fantastic news. It's a clear sign that they're in good health and doing just fine. But what if the score is below a 7? First off, it's not time to panic. It doesn't mean something is terribly wrong. It's just a really clear signal for the medical team that this little one might need some extra help, Maybe a little oxygen or some help clearing their airway to get them comfortable.
All right, so the APGAR score is that first, super fast check-in, but that's just the beginning. Right after that, a whole series of standard procedures kicks in for every single newborn, all designed to give them the healthiest start possible.
Yep, this is literally the baby's first ever physical exam. They're carefully monitoring vitals like temperature and heart rate. They get weighed and measured. They'll also get some protective eye care to ward off any potential infections and a really crucial vitamin K shot. Newborns just don't have enough of it yet, and it's essential to help their blood clot properly.
Okay, so that's the routine stuff, but it begs the question, right? This system is great for the best case scenario, but what about when a baby needs more immediate, more critical help?
And this isn't some super rare event. We're talking about up to 10% of all newborns needing a little help to get breathing. That's 1 in 10. So yeah, this is a common situation, and medical teams are always ready for it.
And this is exactly where that incredible medical safety net comes into play. It's called neonatal resuscitation, and it's a calm, practiced, and highly effective support system designed to help a newborn through those first moments if they're having a tough time.
And this quote here really hits the nail on the head. Most of the time, when a baby needs resuscitation, it's not because they're sick or have a serious disease. It's usually just that their little body is having a temporary glitch adapting its heart and lungs to life on the outside. The problem is about adaptation, not a defect.
The whole process follows the classic ABCs, which makes it easy to remember. A is for airway, making sure it's open and clear. B is for breathing, if they need it, providing gentle puffs of air. Now this is the single most important step. A lot of the time, just getting the breathing going kickstarts everything else. And if needed, C is for circulation, using chest compressions if the heart rate is still too low.
Now, if they do need to get to C for circulation, when chest compressions are necessary, the team actually has 2 main ways they can do it.
So you've got the two-finger technique, which is an option. But the one they really prefer, the one all the guidelines recommend, is the two-thumb technique. By wrapping their hands around the baby's chest, this method actually generates better blood pressure, and it's less tiring for the person doing it, which makes it a whole lot more effective.
But here's the thing. All this incredible focus and care, it doesn't just stop at the 5-minute mark. Not at all. For any baby who needed a little extra help, that support continues with really close observation to make sure they have a safe and healthy start.
Right, so after any kind of intervention, the mission changes slightly. It's all about stabilization. They're watching the baby like a hawk, constantly checking vital signs, making sure their body temperature is just right, and keeping an eye on blood sugar levels to help them recover fully.
So when you think about it, from that first APGAR score to the vitamin K shot, from a gentle rub on the back to a life-saving intervention, every single action in those first 5 minutes is a piece of a larger system. And it all has one single, unified goal: giving every single baby the healthiest start possible.
The incredible coordination in that delivery room really does set the stage for a whole lifetime. And it makes you wonder, doesn't it? What other powerful, hidden systems of care and support are quietly at work all around us, every single day?